Welcome back to the first official Pawsit podcast. I'm Dr. Samantha Dawson. I'm joined once again by Dr. Robert Parkins.
Welcome back, guys.
And we're here to have our first official conversation. We're going to be talking about vomiting and diarrhea. You ready to get going?
Oh yeah, it's everybody's favorite topic, and you're
Yeah.
there at the ER for at least one of these things every once in a while.
Oh yeah. And even in general medicine or primary care, I think I get a call probably 5 times a day. If not, then also a bunch of my exams throughout the day are going to be something to do with vomiting, diarrhea, or I'll have a vaccine appointment where we'll mention that we vomit once a week or once every month or something like that. But that's normal. So I'm here to tell you that's not normal.
Yes, that's a good place to
Start by
start.
saying that.
That's not normal. Let's start there.
But I think real quick to start the conversation about vomiting first, if that's okay with you.
Yeah.
Okay. I think it's really important to know the difference between vomiting, regurg, and reflux, because that is something that
Yeah.
most people do not know is a difference.
Yeah, and actually, I'll probably have you answer some of that because as a Frenchie owner or previous Frenchie owner yourself,
Yes.
they
Anything with a
tend to,
smushy face.
yes, any brachycephalic, smush face breed, they're very much the poster children for regurgitation.
Regurgitation. Right.
I can start with vomiting a little bit and then let you handle the regurg because they're two very clearly different things.
Yes.
And the reason why we want to know the difference is because it helps us know where to look for a problem. I think that's the biggest thing to emphasize for owners. A lot of what you hear about what they are is not true. But for vomiting, the biggest example I give to owners is that it's the noise that gets you out of bed in the middle of the night. When you hear it, you're trying to get your dog off your carpet because you don't want them to make a mess. That's honestly the biggest thing. You see those abdominal contractions, you hear it coming, and you sprint towards your dog to put them outside because otherwise you're cleaning up stuff for a while. And that's what vomiting is.
Yep.
You
So
want to
that
touch on
abdominal
regurg.
component being the
Oh,
major
yeah.
thing. They're bringing something up. And I think the other reason too is that sometimes it helps us know how seriously you need to be running to Robert, or if you can wait to talk to me tomorrow.
Yes. That's also a big part of it.
And so, as far as what Robert was joking about with the smushy face dogs, there are a lot of the ones that will drink water and then just with zero abdominal component whatsoever, just bleh,
Very exorcist
comes
style.
just right up.
Yep.
So if those are happening where there isn't any of that retching before they do it, I'm gonna usually say that that's more likely regurgitation versus vomiting. Would you agree with that?
Yeah, no, that's the biggest difference for me.
Yeah. And then I think where you get a little tricky is when you start people start to mention that their cat or dog are vomiting, but then when you kind of talk to them a little bit more and you're like, well, is there food in it? Are you actually seeing it happen? And usually they're just
Yeah.
finding a little spit up or like a little bile, but there's no food. It's usually happening several hours after they've eaten, so it's more so because of an empty stomach or something like that. That doesn't mean it can't
Exactly.
be regurgitation, but or vomiting, but sometimes it's just reflux actually.
Exactly.
And I don't
And the
know if you've
composition
had
of them
that.
doesn't matter in terms of what they are, like whether it has
Mhm.
food in it, water. I've seen regurg have food. I've seen vomiting have food. I've seen them both have water. So the composition doesn't matter for the difference. It's really just the action. We also understand that sometimes you're not there to witness it, and that's okay. Just letting us
Right.
know that, hey, we didn't see it actually happen. And then, we do our best guess to kind of use the information we have to go from there.
Right. But I think definitely the serious nature of it, if we think it's more like reflux or regurgitation, I'm going to generally be a little less concerned that it has to be
Yeah,
an emergency than if we're actually vomiting and we can't keep any food down, we can't keep any water down, then I'm
totally.
definitely going to be a little more concerned.
Yeah, I'll say that's very true, especially for more the chronic conditions or like they're doing it frequently. The only time I'll say that's exception when it starts with vomiting
Hmm.
and then progress to regurg afterwards. A lot of times then we do worry about like a foreign object in the
Yeah.
animal's stomach or their
Yeah.
small intestines can kind of think of it just like a blockage. Things are just backing up. So food and water will also back up and then come back out as regurgitation when it kind of exceeds that vomiting
Oh
component.
yeah, once we're past that point. Yeah,
Yeah.
that's absolutely true. And I think generally, and again, there's a bit of nuance here and there, I think, with some of these things. There's like a rule of thumb, but that there's always those things that don't follow that. And so
Yeah.
the baseline for all of these conversations is actually just knowing what's normal for your dog. So like if your dog is generally like I have a lab, right? I have Gus. Gus is a cool guy,
Of
but
Gus.
he never stops eating. Like he would eat every minute. So if a
Yes,
lab's not eating,
that's a
there's a
problem.
problem.
Hmm. It's
You
very,
know.
yeah. The
And
beagles, labs, they live to eat.
right, exactly. They're like goldfish. They just want to keep eating. So certainly that's going to be, part of it too. And I think the question of, is it an emergency, is it urgent, or is it something that can wait, are all kind of tied into that. If your dog threw up, okay, you don't want to ignore that. That's for sure, especially if you saw the abdominal component or you didn't, whatever. Um, but if they're running around happy and they're like acting totally normal, it's probably not something you need to run to see Robert about. But it,
Yes, I would 100% agree with you because honestly, the number of times, and we'll probably get into this with diarrhea as well,
yeah,
but the number of times someone comes in with a dog vomiting one time, that's okay. Especially if they're as Sam said, is they're acting okay, they're running around like nothing ever happened, they're fine. Like,
yeah,
don't feed them or give them water right afterwards. That's probably the number one mistake I see from
me too.
most
Gut
of the pet
rest.
owners. So that's probably the biggest mistake by far because they feed them right afterwards. Like, oh, they vomited again. Like, yeah, I would
But
too. That
yeah.
that
Well,
sounds
it's kind
terrible.
of a rule. It's funny. I think sometimes people forget that that's what you do. Like if you or
Mhm.
you have a child, that vomits, gut rest. You don't just give it, you don't just like reactivate their gut again. You
Yeah,
make them wait. I don't
yeah.
know. I
Give them
usually
six
say 4 to 6
hours.
hours.
Yeah, exactly. 6 hours. Give them saltine
Yeah.
crackers later.
Yeah.
That's what my mom did with me, and it worked. So,
Yeah, and then but that is a big thing that I'll say to people. Okay, gut rest 4 to 6 hours, and then try a very small amount of a bland diet. So you joke about the saltines, but we tell people every day, if you can come by and pick up some ID or some, like specifically gastrointestinally, like easily digestible food, great, come by and get it. If not, boiled chicken, white rice.
yeah, I think that's a great description of like what bland diets are. Sam was referring to like Hill's ID. It's one of the major like pet brands.
Yeah,
They
sorry.
have a GI diet. No, I got you. No worries. It's one of the big GI diets. It's a prescription diet, but it's great because it's bland. But yeah, if you don't have it, boiled chicken, boiled turkey, boiled beef, whatever's boiled that has removing the fat content from it.
Hmm.
Don't put salt and pepper on it. Like just bland. And
Right.
again, the most important part is small amounts because
Small
otherwise
amounts, right.
bad things will happen.
And also remember too that when you're feeding your dog boiled chicken, boiled rice, there is a lot of moisture in that. So if they don't go off and drink the way they do when they eat their kibble, that's fine. They're getting
Mhm.
moisture from that. And
Exactly.
the whole point of just stopping the vomiting is already going to help for them not to be losing more. People are always worried, but they're going to get dehydrated. I'm like, they're not going to get dehydrated from
They'll be
vomiting all the
okay.
time. Yeah. All right.
Exactly.
Yeah. What is it? When do you consider it an emergency? What is that? What's that thing that you're like, uh-oh, that's a problem?
For me, honestly, when I talk to owners, the biggest thing is to try and find out the time between vomiting. Like if they vomited 5 times in an hour, that's not as concerning to me as someone who vomited 5 times throughout the day,
Mm-hmm.
because that's a bigger difference in terms of like, yeah, your stomach's upset, you're gonna get sick a couple times in the hour. That happens to us too. That's not a big deal. But the fact that you vomited 5 times throughout the day or not being fed or there's no water involved, and then if you're acting lethargic, or
Yeah.
sorry, just not your normal self, that's a big concern for me as an ER veterinarian. Those are the two questions I ask every time.
Yep. Me too.
I don't
I
know,
always
but
want to
yeah.
know, are like, do they seem like they want to eat? Do they seem
Mm.
like and that, obviously if Loki doesn't eat for a day, I don't think you're having the same feelings about that I am, because Huskies will go a day without eating and that'll
Yeah,
be
no, he's a
fine.
giant pain in my ass. He'll literally, I'm like, now you're getting 12 now. I gotta start worrying about you having these things. I'm not sure if you're not eating because you're being
A
my
Husky?
dog. Exactly. It just happens all the time. It drives me nuts. So
Yeah.
one day he's gonna catch me off guard. But in the
Right.
meantime, yes, know your dog. That's and people do know their dog. That's the most
They
important
do.
part.
And I think it's also fair to say there might really be something wrong with your dog. That doesn't mean it's that you need to run to the emergency clinic. That means notice it, take notice of it, maybe even start to write notes down, because that is one thing that I find that we'll get a lot of different, depending on like if we first have an assistant or a technician go in and kind of get some information, and then they'll kind of remember something, or they kind of think maybe it was this, and sometimes it really does matter that it's been 4 days that they haven't eaten, or maybe it's been
Yeah.
a week. And the other thing too is, don't tell me that they haven't eaten just because they haven't eaten their food. That's not the same thing as they didn't eat.
Yes, I agree 100%. That's
Yeah.
very common.
Yeah.
And just a quick shout out to what Sam was saying is when your technicians go in, it's Tech Week coming up soon.
Oh, yes.
Make sure we appreciate all of our techs. They're honestly the backbone of what we do. We can't think of enough. And I think even Sam had a recent experience where she was left solo at the clinic for a bit.
I
And
was, yes. And my right hand was missing because my tech was not there. So yeah, no,
yes,
I mean, they do the job of 8 people and
yeah,
they do it well and they do it with, I mean, just love, absolute
yeah, because
kindness and
it's
love. I mean,
they're lovely
they're
people, and we encourage you to be as nice to them as you are the doctors too, because they do so
yeah.
much for us. And they're the ones that are really the ones taking care of your pets half the time as well as they are. They're doing great.
They're
So
following through with all of the things that we're asking them to do. And,
mhm.
a lot of the times, we get to give them the initial snuggles, but they're the ones that are giving them the snuggles the rest of the time they're with us. So
Yep.
yeah.
So anyway, sorry to interrupt, but we just want to make sure we give a shout out
No,
to people
it's
that we care
such an
about the
important
most.
thing. And we'll
So
talk about that more. We'll probably dedicate a bit more time to that when it actually is Tech
oh, is
Week,
it not
but it's
this next
coming
week?
up. Hmm?
It's coming up next week, or is it
No, I think it's 2 weeks from now.
2 weeks? That's fair. Well, in
Yeah.
that case, happy Future Tech Week. We'll touch more base on that
Yeah.
soon.
Yeah, no. But so I think, with vomiting, I think the big take home there really is just like gut rest. Make notes of when they were last normal, when they last
Mhm.
ate, what they last ate. Try to think about maybe what could have triggered it.
Mhm.
If you have sometimes a young dog's going to mean one thing to me versus a 12-year-old dog or something like that. I may have a
Exactly.
different idea of what could be the cause. And so if you have anything that you can think of, make notes. That's fine. I don't mind. People come with notes. I'm like, great, awesome,
Yeah.
cool. Um, and then as far as um little things like with like the reflux, I found that like sometimes dogs really just need a small meal just before bed or something like
Yeah.
that, and that can really make a huge difference. Sometimes they're just not on the right food for themselves
Mhm.
too. And so really like having a conversation, and I think that those are probably the conversations I have more
Yeah.
so than you have. I would imagine you're just kind of fixing the problem at hand, but then sometimes some of those more chronic things, I know those are the things that I'm usually working on with people.
Yeah, no, I think it's a great point because even a lot of the owners I'll talk to, they'll say, "Oh, my dog vomits chronically," but my vet told me it was like a bilious vomiting type thing where they're vomiting bile. It's because they weren't eating, and so that's definitely stuff we appreciate because it's good to know that information ahead of time. So it's definitely stuff that is covered ahead of time, and that
Right.
helps kind of remove it from the equation a little bit more.
Right. Right. It's to kind of understanding why that might be happening with your dog and that
Mhm.
that's, on the spectrum of normal.
Yes,
It's not normal.
as normal as it can be.
Yeah. And then with the smushy face dogs, there are things you can do to maybe make it so that they aren't drinking so fast or they aren't putting themselves in a situation where they are being a bit too exuberant.
Oh
And
yeah,
then
small amounts of water in their water bowl is going to help, just so they don't
mhm,
go to town and then like
it comes
not
right
drown
back
themselves.
up.
But yeah,
Hmm.
exactly, so they don't put it all back up right away.
Yeah.
Um, those are kind of the big and certain medications, I think, Prilosec and famotidine,
Yeah.
or Pepsid for other medications.
Right.
Those are things to talk to your vet about because that'd be a good way to reduce that from happening on a frequent basis.
Oh, absolutely. Yeah. I find, and I think every doctor has their favorites, they have what works
Mhm.
in their hands, and there's
Yeah.
certainly things, but there's not just one way to do things. And so you should always talk to your vet before you give anything. Cause yes, those are
Mhm.
very, very safe for our dogs, but you also need to know the right dose. It's not the same as people. And it if you're not giving enough, it's not going to work. And if you're giving too much, well, you don't want to do that. So
Yeah, I
definitely
think
ask your
that's a
vet.
really good point in terms of don't just give medications without talking to a doctor. It takes literally a couple seconds,
Hmm.
but it can be a huge game changer because I've had so many clients give stuff that they thought was okay for their pets, and then I've got to hospitalize them afterwards for a kidney injury,
Yep.
or a liver injury because they thought it was okay. They read somewhere online, but the dosing is super important. Some dogs and cats are more sensitive to medications than other ones.
Yeah.
So it's really important just to take that 5 minute phone call, call your local ER, call a telehealth service, anything. Call
Yeah.
someone just to double check because Google is has a lot of great information somewhere. It's
Hmm.
just hard to find sometimes.
Yeah, and you don't know if you're looking at the good information or outdated information too.
Mhm.
Things are changing all the time,
Yeah.
and we take a lot of time to try to make sure that we're staying up on that. So, I think that's really important. And along the lines of the medicine thing, it's kind of a deviation from vomiting and diarrhea, but especially if you have an exam, like if you're coming to see me today, don't just give something, because sometimes then I can't give other medicine. I mean
No,
aspirin. Don't give aspirin to your
no, yeah, please stop giving aspirin
Just stop.
across the board. Just stop
Yeah.
giving it.
But I just mean that I can't give, the meds that,
No,
I
I
would want to
agree.
give. Yeah.
That's probably the
So
number one drug that people give their pets that,
I wish they would stop.
yes,
Yeah.
exactly. Like stop giving aspirin.
Yeah.
Yeah, just don't
Yeah.
do it.
Unless your veterinarian prescribes it for a very specific reason, and there are only very few.
Yes, very, very
Only
few.
one I can think of. So
Yeah,
yeah. But yeah, don't use it.
no,
Call ahead, please.
go ahead. Um,
But then kind of transitioning over to diarrhea. So for sure, diarrhea is very, very common. And it's funny the different level of what people will put up with as far as diarrhea goes. And I would just say this: do you go to your doctor every time you have diarrhea?
that's an excellent question to ask yourself. Because yeah, the spectrum between what people bring their pets in for is insane to me sometimes. And
Yeah.
it's not because they don't care. Sometimes they don't think it's a big deal at the time.
Yeah.
But it's the one episode of diarrhea that I've seen, or it's someone who's literally had a dog having diarrhea for 3 weeks. I'm like, meet somewhere in the middle and we'll be good.
Yeah. Oh, yeah. Oh, yeah.
So that'd be
Well,
ideal.
and if they've been having it for 3 weeks, then most likely they don't necessarily need to see you.
Pre-COVID, yes, I would 100% agree with that. I feel bad. You guys are so busy as to kind of like, and I think that's a problem across the entire industry. COVID changed a lot of things for our industry, as it did with many others. But we lost a lot of veterinarians to retirement. There's a lot of people that got puppies and kittens, and it kind of boosted the number of veterinarian or pets that need to be seen per veterinarian.
Yeah.
And unfortunately, it makes it so much harder for you to get into your primary practitioner now. And
I
that's why I feel
think
bad for
even,
owners the
and
most.
I would say even the ER. I mean, every single
Mhm.
person that I talked to was like, well, I waited 6 hours, I waited 10 hours, or I was told that they weren't going to get to me today.
Yeah, it's so true. And we
Yeah.
feel bad. I hope people know that we truly feel bad. We try to do as much as we can.
Oh, yeah.
There's just only so much time in a day. And
Yeah. Well, and it
yeah.
gets to a point where there's only so much you can do well.
Mhm.
Right.
Exactly.
So, and I think that's the biggest thing for us when there's usually only two reasons that we say that no, we won't see somebody, maybe three. One, that it's something that can wait. You know what I
Yeah.
mean? Based on the history, I'm gonna tell you from my experience, what you've just told me can wait. So
Mhm.
give me a day or two. I get that you're worried, and that's fine, and you should be, and that's why we would need to see them. But sometimes there's already so many other things that we have to see that day, that if we were to add your dog or your cat, they may not actually get the care that they need or deserve, because there's just so many.
Yeah. It's absolutely insane.
Yeah.
It's how much things have increased. Why it's like I used to see 12 cases a night on ER, and now I see 20 plus cases a night. That's all just because of COVID. Like honestly,
Yeah.
nothing else to it. And I'm sure
Yeah.
the same as like I've talked to people like yourself.
Mm-hmm.
They're slammed
Yeah.
all the time. And again, it's not due to not wanting to see your pet.
And it's never that. I mean,
Yeah.
sometimes it's also depending on what you're explaining to me, because I have a specific type of practice. So, I have things that Robert doesn't have at his practice, but he has things that I don't have. And
Mhm.
that's because you can't have everything. You know what I mean? It just isn't like feasible as far as, if I only see one particular type of thing one time every 3 years, I'm not going to have the medicine. I might know what they need, but I don't have it you know
Mhm.
and so you'll tell me, hey, this is what's going on with my pet, and I'm like, oh, well, then you need to go there, because they have something that I don't have, not
Yeah.
because I don't want to see them. And I think that that is always very hard, because some people just have such trust with their day vet, their primary care vet,
And
that
as
they're,
they should too. Like they built that relationship. That's awesome.
yeah. Well, and it's super important to us too, but it's not because we don't want to see them. I
Mhm.
really don't think that that's ever a factor. It's really just, oh man, yeah, I can stabilize a pet in most cases, but I don't actually have an oxygen cage. So if your dog can't breathe,
Mhm.
you know what I mean? There's another place to go that has that. You know what I mean? Like I can stabilize you, but I don't, so
Yeah. I
totally
think
off the
when
topic of diarrhea, but
I know, yeah, we're back, but I agree, like 100% agree.
yeah,
We'll get into that topic another time in detail
yeah,
because it's a big one.
yeah,
But as for diarrhea,
yeah, diarrhea.
honestly, at the end of the day, there's a lot of causes. We're not going to go to any of them, to be honest with you, because you'll do that with your veterinarian anyway.
Yeah.
But at the end of the day, just make sure you give a good history. A lot of times, it's just something your dog ate, and most time you're never, if you go to see any doctor, sometimes you're never going to find the answer to what actually caused it. And I
Right.
just want owners to know that walking in, like, we're not going to do all these GI fecal exams for the 1 or 2 times your dog's had diarrhea, because one, it's a waste of money, and most of the time it'll resolve on its own. So we're not going to know what virus or bacteria is causing it. We're going to not know if your dog ate the grass or the sticks or the goldfish your daughter dropped earlier that day.
Mm-hmm.
We just don't know sometimes, and that's okay. Not knowing is not the problem. It's making sure your pet's still okay in terms of stability.
Mm-hmm.
That's the important thing of the day. So just want owners to understand that sometimes it's tough not knowing. That's why we're in
Yeah.
this field.
Oh yeah. Oh yeah. No, for sure. And two, I think it's I always think there's a difference between soft stool, which is
Mhm.
annoying,
Yeah.
and diarrhea that they can't get outside to, you know what I mean, and they just keep going and they're not, you know what I
Mhm.
mean, and especially like we going back to the vomiting thing. Well, how are they acting? Are they acting completely normal, eating and happy, and they just or have a little loose stool? Okay, yeah, sure, we can do something about it, but
Yeah.
it's not going to resolve in 24 hours either. And so that's
Yeah. There's
okay. It's going to take a
there's no
minute.
magic pill for diarrhea, unfortunately. I
Mm-mm.
wish there was, to make all of our jobs a lot easier, but unfortunately it usually takes a couple of days to resolve no matter what we do.
Right.
We can
Right.
obviously help, but
Yeah.
it takes some time.
Yeah. And you don't want to just throw something at it just because, you know what I mean? You kind of
Mhm.
want to come at it from like, oh, well, what's, there's usually a systematic approach, I would say.
And Sam, how do you feel about blood in the diarrhea?
I really think it depends on how much blood there's in the diarrhea. A tiny little bit of blood, I'm like, yeah, okay. I mean,
Mhm.
it happens. We know that. I always tell people it doesn't mean that your dog or cat has colon cancer. It's totally different than if you were going to the bathroom and you see blood. Then I think people are like, oh no, I
Yeah.
have colon cancer. Cats and dogs, we know when they get inflammation of their colon, we'll see frank blood. I know there's other reasons too, but like for small amounts, like that's not gonna make me too nervous actually.
Yeah, I agree. Unless I see it looks like they're pouring blood out of their
That is a
back
different
end, which is
story. Yeah.
terrible description. But yeah, if that's the case, then yeah,
No.
I'll get a little concerned. But before that, I agree. A couple
Yeah.
drops where it's reddish in color. There's
Doesn't
very
always
few
even
times.
mean it's really frank blood just because it looks a little red also too.
Yeah.
And I think that that's the other things people just automatically assume that it's got to be blood. And it's like, well, what did they eat? You know what I mean? Remember that like there
Mhm.
you might be seeing something that's not actually blood too.
Yeah.
And also how are they acting? Are they running around
Yeah.
happy as a clam? And then okay, so a little bit of blood, no big deal. But if they are super lethargic and there's a bunch of blood coming out, well then yeah, that's an emergency. There's no question. And we know that they're gonna need to be treated.
Mhm. And just because there's blood back there doesn't mean there's a foreign body either. I
Oh
get that one
no.
a lot. A lot of people are like, oh, if they're bleeding inside from something they ate, and it might be something they ate, but it's not necessarily causing obstruction.
Right.
And that's probably the one thing I think a lot of owners, and reasonably so, it makes sense. Dogs can pass a lot of things. I've seen them needles, uh, actually full knives. Um, it's
Pass a full
actually,
knife? Oh gosh, I've
yeah,
never
it was
seen
like
that.
it was like a smaller knife, but it was definitely like it was a Great Bernese mountain
How
dog,
do
and it
they
just
even eat that? I know it's amazing.
they didn't find it until it's funny they didn't know the dog ate it until it passed out the other end, and I'm like, the fact that you didn't perforate something's insane to me.
Is
Um,
amazing.
but yes, though dogs eat a lot of things and not have problems, it's actually quite amazing what their GI tract can do. Doesn't
Yeah.
mean to feed those things, but just keep that in mind. It doesn't necessarily mean there's your dog's bleeding because of those things. Sometimes, like I said, it's
Well, and
just
if you think about it, I mean, if they were, it wouldn't be coming out as frank blood
mhm.
usually, right?
Yeah.
So if there's blood that they're digesting, it's not going to actually look like that. It's going to look black, tarry.
And that is a good thing to bring up to the difference in it too. Tarry blood or black looks like tar is more like towards your stomach that your body's actually digesting, whereas more the frank blood that Sam and I were referencing is more towards the exit,
Mm-hmm.
essentially.
Right, right. And the other thing to think about too is that like the stomach, well, the intestines, it's not under a ton of pressure, so that's how they can pass these things,
Mhm.
right? I mean, that's the way to think about it too.
Yeah.
So, I mean, not that we want to take a chance with
Yeah.
anything.
We don't take chances a lot with it, but
No.
it's something to keep in mind.
Yeah, yeah. No, I mean they are pretty incredible and a lot of things are more self-limiting than people realize. And so sometimes even some of the times where people are like really, really wanting a solution, what they don't realize is that it may have gotten better and it had nothing to do with whatever medicine or,
Yeah, anything that
intervention
we
there
gave.
was.
Yeah.
Yeah, yeah, But then if it is lasting, I mean, you should definitely be calling in and checking and seeing if they can be seen for sure. And
Yeah.
I think too, also again, looking at is it a puppy? Is it a puppy that's got diarrhea and is acting super lethargic and
Mhm.
maybe isn't vaccinated?
And we worry about parvo, and that's
Worried
no
about
fun.
parvo. Yeah. Or even just had one vaccine, you know what I mean, and isn't
Oh yeah.
fully vaccinated or something like that. Versus that older dog or something like that where, but I think how they're acting and how they're behaving and what you
Mhm.
know to be true of your dog. Because yeah, there's a ton of diseases that, can cause vomiting, diarrhea, GI upset, things like that.
Yeah, I think that, yeah, the big take home point is just watch how your dog is acting. I think
Hmm.
Sam hit it kind of on the head where it's such a big factor in terms of how they're responding to things. If they're lethargic, be concerned. If they're bright and bouncy, watch,
Yeah.
be aware.
Yeah, absolutely. I think you are your dog's absolute best advocate. You know them the
Mhm.
best. This is my favorite thing to tell people. I'm like, okay, you know them the best. You think there's something wrong, you're probably right. It might be little and it might be big. I don't know. That's what we're gonna try to figure out.
Honestly, that's so true though, because how many conversations I have with people where they notice something small is off, and honestly, on our exam, I can't determine what it is. I'm like, I honestly, they look great here. They're acting like don't diminish what you're seeing. You know your pet, but
Yeah,
sometimes it takes a little bit longer for
things
stuff
to
to get
present
worse or it
themselves.
gets better.
Hmm.
And like I
And then
had
you
plenty
don't
of
know.
dogs. Exactly, I had plenty of dogs come in and they're acting a little off at home, but they're fine when they walk in, and they go home. They have a massive amount of diarrhea, and you're like, oh, that was a problem. They're probably a little upset, and they're fine now. So
Hmm.
just things like that, I think, are really important to keep in mind. But we're not all knowing, but we try and do our best to help you out as best we can.
Yeah, yeah. I think that's the most important thing too is also understanding that like things sometimes take time to present themselves, which I think getting back to w- what brought us here was where we are doing myBalto, which is
Mm,
our platform where you have access to your medical records at all times, which I
yeah.
hope that you go and check it out because it's really great. But that's the point is that sometimes, I'll see a dog or Robert will see a dog and we're like, okay, yeah, they really don't look so bad. But if they don't get better in, such a certain amount of time, or just if you
Mm,
feel like they're going in the wrong direction, well, they need to be seen again because there are some things that take time to develop. And even sometimes some of
yeah.
the diagnostics we do, like when you think maybe your dog ate something that they shouldn't have, but I look and I'm like, well, I don't see an obvious obstruction
Mhm.
because that pattern hasn't started to build up. And so we
Oh
won't
yeah.
know maybe for a few hours. So then if you could see what I saw and go, yeah, I didn't see it then, but look at the difference now. Now we have a comparison and it's a big difference.
It's a huge difference, and I think you hit on the nail on the head because we'll just be able to compare that X-ray to one that was taken earlier, and you see that pattern form. But if I don't have those X-rays beforehand, oftentimes, then I gotta usually keep you in hospital because your dog works looks worse at that point.
Right.
We keep them in hospital, and then we repeat them in 12 hours, and we're like, oh, now we see that progression that was probably seen earlier, but it's 2 a.m. and I can't get your records right now. So
Right.
um, definitely check out myBalto just to have that information. Honestly, I know it can save you information, but it just gives your vet a better chance to treat your pet appropriately.
Hmm.
And that's literally the most important part at the end of the day.
It's something that I try to do every time I see a dog where I'm like, don't know if they're going to get better. I mean, I'll be like, here's the blood work, here's a copy of the radiographs, and then when you kind of came to me with the idea of myBalto, I was like, yes, like people need this. They need to have access to this because it is so important. And wouldn't that money be better spent towards a
Oh yeah.
surgery if they need it, or towards some other kind of diagnostic where you're going to get that answer a lot faster? And think about how many times things don't go the way that you want them to because you couldn't get them into surgery fast enough or something like that, whereas
Oh yeah.
if you could, then we're having a different conversation. And so I think, man, the more you can do to be your advocate, for your pet, and using things like myBalto to have access to those records, maybe even if you really aren't sure if you should go see Robert or wait to see me, then call and talk to one of our people who will help to triage them and say, yeah, this needs to go, or no, this can wait. I think you're doing okay. Talk you
Yeah,
through it.
exactly.
It's really
Just
helpful.
exactly. It's never a bad idea to call someone. Like I said, myBalto's vet teletriage service is coming very soon, so we hope to
Hmm.
offer that to you guys. Hopefully in the next 2 to 3 months.
Yeah.
But even then, like call your vet, call another telehealth service, ask a question. It's worth it because honestly, it might save you. You might spend $30 or $50 for a phone call, but it saves you 110 coming into the clinic.
It's huge.
That's it's huge. But if it's something worse, you do need to be seen, then you'll be glad you spent it ahead of time to get to where you need to be.
Right. Absolutely. 100%. And I think anything we can do as time goes on to answer more burning questions you might have, if there is something that you've experienced and you'd like to ask, we can't get too personal as far as like specific diagnosis and stuff like that without being, the actual doctor that have seen your pets, but we can talk in generalities, kind of like we did with the vomiting and diarrhea. And so we plan to kind of go through some of the most common questions that are asked. So we can start to maybe get to some of the questions that people are interested in hearing, but getting to hear them from an ER doctor and a primary care doctor.
Yeah, I think it's really excited to have you guys here today. And then, yeah, we can't wait to hear your guys' questions.
Yeah.
Bring
So
them on.
yeah, give the email again.
Yes, podcast at mybalto.com. Feel free to send them over there, and then we'll be actively checking that account for future podcasts. And along with that, we'll have guest speakers in the future to talk about cool new products that you may not be aware of that can really benefit your pet's health. It's things that I think we think are hopefully either save you time the better, save you money in the long run, and just
Yeah.
really make your pet's life better. And I think that's huge.
Yep. Our whole goal really is to just make veterinary medicine more accessible to people, both financially and through understanding, through kind of just having conversations like this where, let's just have a chat about something that is going to happen. Your dog is going to have diarrhea. Your dog's going to
Always.
vomit. So do you panic or, maybe just think about it the way that maybe we've brought it across and hopefully it's helpful and it makes some sense.
Yeah, no, I love it. So appreciate you guys' time today, and yeah, bring on the questions.
Yeah. Bring them on. Great to talk to you, Robert.
Good seeing you, Sam, as always.
Bye. Have a
Bye.
good night.